Well, hi everyone, it's great to be with you again. I don't know about you, but it's hard for me to believe that fiscal year 18 is over already. And we started a new fiscal year, FY19. But let's talk a little bit about fiscal year 18, because we accomplished quite a bit as a healthcare system and have a lot to be proud of. For example, we completed our triennial Joint Commission accreditation and passed that inspection with flying colors, thanks to many of you. We had a mental health car survey that some of you may have seen published in the Temple Daily Telegram, where we had one finding that was a simple recommendation that we resolved right away. We had our first OIG chip survey, a new survey process that the OIG is using to replace the CAP survey process. We maintained our 3-star rating in sale, specifically hospital-based sale, but we also attained a 4-star rating in our Temple Community Living Center and a 3-star rating in our Waco Community Living Center. We improved our provider productivity in almost every subspecialty, medical, surgical, mental health, etc. We expanded sites of care. Many of you saw that we awarded a new lease for the Cedar Park Clinic. I've talked to you about that. And the LaGrange community-based outpatient clinic that we successfully transitioned from a contracted site of care to our very first VA staff site in LaGrange, Texas. We also entered into very innovative new partnerships with the University of Texas Dell Medical School, both clinical and research endeavors that we'll be spending a lot of time on in FY19. And on top of all that, we had a number of national recognitions, from recognition of our integrated case management program to our innovative partnership with the Central Texas Food Bank. So that is by no means an all-inclusive list, but FY18 was a great year for the Central Texas Veterans Healthcare System, but we have a lot of work still to do. I talked to you about SAIL. And that we have a 3-star rating in the hospital. And I'm happy to know that we've sustained that 3-star rating for the last several quarters up to the last year. We've been a 3-star facility in VA. But I would assume, like me, many of you aren't satisfied with that. So while 3 stars is considered acceptable by VA standards, nothing less than a 4-star is acceptable by my standards, and I would hope by your standards as well. So we got a lot of work to do there. And we'll continue to work with our clinical leadership throughout the course of FY19 to make progress on our overall star rating. We also have quite a bit of work to do as a healthcare system when we talk about the patient experience. And I want to give you a bit of perspective when I talk about patient experience, because right now we really have 3 distinct narratives that we all need to understand. And 3 surveys that we primarily use as a healthcare system to evaluate the patient experience. The first is V-Signals. Many of you may have heard me reference this as Medallia. It's the same system. VA just recently changed the name to V-Signals. This is the largest pool of surveys that we get from our veterans, and universally we do fairly well in V-Signals with a trust score from our veterans of around 84%, meaning 84% of our veterans are telling us that they trust VA to provide the care and services that they need. But there are 2 other surveys that VA sends out to our patients where in one case we're doing well and the other we're not. So let's talk about the one that we are doing well. That's our inpatient SHEP survey. So this is a survey that's mailed to veterans post-hospitalization, and they tell us what they thought about their care in the hospital. And historically, especially for the past year, we've been somewhere between the first quintile, which is among the best performing in the country, to the second quintile, which is slightly below that, but still considered high performing with veteran perception of inpatient care when they stay with us in Central Texas. But here's where we aren't doing well. Where we aren't doing well is with our outpatient SHEP surveys. And this is where we're asking patients about their perception of access in the outpatient setting, whether it's specialty care or primary care. And we also ask them more pointed questions about what they think about their primary care provider and the PAC teams who are caring for them. This is an area as a healthcare system where we're not doing well, but I want to be clear. When I say we're not doing well, we're amongst the lowest in the country. And I know we're better than that. You know we're better than that. So this is an area over the course of FY19 that I will personally be paying a lot of attention, working with our clinical leadership in ambulatory care and nursing and our ADPCS and chief of staff to ensure that we're not only resourcing primary care appropriately, but that we also have processes in place, roles clearly defined, to ensure that we're giving our veterans the experience that they expect and deserve when they come to see us in primary care or when they're calling us in lieu of a visit, and to ensure that we're addressing those needs. So you'll hear a lot more about outpatient satisfaction. Something else I want to share about FY18, we did the all-employee survey, and we did receive the results. The survey was in June. We got the results in August. I know we published those results. I've sent you some emails about the results, and we've put them on our homepage. So if you haven't gone to look at the healthcare system-wide results and your work group unit specific results, I really encourage you to do that. Go to the homepage. It's on the bottom right-hand side. It's a little blue icon for the all-employee survey. Take a look at it. You should expect to hear from your service level leadership and your immediate supervisor to walk you through those results, but it's always a good idea to go in and look at them yourself so you can be familiar with the data and what your work group identified as the priorities as you all discuss them then at the service level. So here's what our employees told us at the healthcare system level was important for you going forward in FY19. Like last year, we had a chance to identify top 3 areas. We did the same thing this year, and the top 3 areas of our staff were communication. So this year, 47% of our employees told me that they thought communication or improving communication in the healthcare system was a top priority. That's a change from last year. Last year, accountability was number 1. This year, accountability is number 2. 43% of you said that you wanted us to address accountability in the organization. So we'll continue to focus there as we have in the past year. And last but not least was growth, focusing on your individual growth and development in your roles and in your career. So we'll continue some of the efforts that we started last year there as well to make sure we're meeting your expectations. Last thing I'll tell you about the all-employee survey. Historically, we've done the all-employee survey once a year. The large survey is still going to occur once a year. But VA has also initiated what's called the Best Place to Work survey. It's a very quick survey. It takes about 30 seconds for employees to complete. And this one's going to start coming out to you quarterly. We just completed our first Best Place to Work survey. And we had about 20% of our staff complete the survey, and we'd like to see that get closer to 57% as we had in the all-employee survey. But we'll continue to let you know when those surveys are being republished so that we can have your participation. Okay, so let's talk a little bit about FY19. We're very early in the year. We're aggressively obviously receiving your feedback and working with our governance councils to make sure that Central Texas healthcare system stays on the right track to meet not only your expectations, but our veteran and other stakeholder expectations. So what I can tell you up front is that FY19 is going to be a very definitive year, not just for the Central Texas Veterans Healthcare System, but for VA as a whole. So we'll talk briefly about our healthcare system. We're going to have some key construction projects that are going to get started in FY19. Again, not an all-inclusive list, but as many of you may recall, when I came on board, I started in a 180-day plan. In that plan, one of the things we identified was the need to transition out of the modular buildings that we have in front of the hospital here in Temple, and to start looking for permanent homes for those staff. Well, I am happy to announce that one of our first construction projects to begin that transition was funded this fiscal year. That'll be for Building 45. We'll be renovating that building and preparing it for occupancy for several of the administrative services that are in the modular buildings in front of the hospital. So we'll keep you up to date as that construction project gets started, and obviously as it nears completion. For those who will be moving from their current modular structure to that building, you'll be contacted by engineering and others to make that transition smooth. We're also going to start construction pretty soon on our parking garage. That parking garage is going to add at minimum 364 parking spaces to the Central Texas Veterans Healthcare System. And I know many of you are excited for that transition. What we're likely to have is the parking structure used for our staff, since it'll be further away from the hospital, which should free up parking spaces for our veterans. But again, we'll have more discussion with you all as we get closer to actually opening that structure. I've already talked about the Cedar Park lease, but we obviously have not only awarded the contract, we're getting very close to finalizing the design. We'll expect construction to start during the fiscal year and hopefully move into that new clinic during FY19. What I don't believe I have shared with you yet is that we've also awarded an expansion of our College Station community-based outpatient clinic. Getting close to finalizing that design, and we'll expect that construction to also begin this year. What I'm really proud to announce is that we secured funding for the renovation of both the Temple and Waco canteens. So we're getting very close to starting construction here in Temple. VCS has been working with us very proactively. We actually funded both of these projects, not Canteen, so they're making sure their design meets our expectations here in Temple. Expect that to start here pretty soon. And since we just secured the funding for the Waco Canteen, I can't give you a time frame for construction, but do expect that to begin this year, and that'll be about a $2 million construction project. Last but not least, we've had a lot of discussion when we talk about construction with our with relocation of several programs, like our women's trauma recovery unit here, and transitioning that to Waco. The renovation of Building 7 in Waco has already begun, and we do expect in the coming months to transition our women's residential programs to our Waco campus, and so the staff who will be impacted by that have obviously been involved. At both the local and the national level, FY19 is going to be definitive because many of the changes in the Mission Act, and again, this is the replacement for the Choice Act, will go into effect. Many of those changes will start in March. And so what we're looking as a healthcare system is to ensure that we are reinforcing our foundational services. And for us, primarily, we're talking about primary care and mental health. Several of our specialty areas, but really looking at primary care and mental health services. And so a lot of activity there, trying to ensure that we're seeing our veterans timely in accordance with the Mission Act. We're also have been looking very closely as an institution at financial solvency. And there's two specific things I want to talk to you all about related to financial solvency as a healthcare system, because I know many of you are under the perception, because I've heard it, that the healthcare system is currently under a hiring freeze. Let me make absolutely clear, there is no hiring freeze in the Central Texas Veterans Healthcare System. We brought employees on every pay period since I've been here. What I can tell you is over the last several months, we have slowed the number of staff that we're bringing on board. And that's to ensure that we're bringing the right staff on board and that we're living within our operational budget. But there is no hiring freeze. What we are doing is looking much more aggressively at where we have staff and where we have resources, and looking at opportunities to right size. So I charted 10 what we called efficiency initiatives that had a myriad of teams involved, systems redesign involved, and we looked at opportunities to both evaluate processes, evaluate programs and FTE, and look at opportunities to realign. Those teams have outbriefed our Quality Safety Value Executive Board with some pretty aggressive recommendations. A number of those recommendations I've approved, and those notices have gone to AFGE. So for the staff who will be impacted, you'll be involved in those discussions and negotiations. But I do want to first give thanks to the teams who were involved in those efficiency initiatives, and because of their efforts, we've saved approximately $4 million to date as a result of the recommendations that they've made and that I've approved. So we look forward to seeing those changes come to fruition. Last but not least, that I will mention for FY19, but I believe you'll hear more from another speaker, is about our Pathways to Excellence journey. This is something that nursing announced in FY18, that as an organization, we have decided to proceed with a Pathways certification. And I think is a truly monumental transition, not just for the Central Texas Veterans Healthcare System, but for the clinical services we provide and for nursing service as a department. And wholeheartedly support this transition, and I look forward to working with nursing and working with our clinical leadership to achieve that certification. So with that, I want to thank you for an excellent FY18 and look forward to an even better FY19. Thank you.
Hi, my name is Lisa Herrera and I'm your sales coordinator. I'll be providing you an update today with our progress and would like to begin briefly by describing what SAIL is. SAIL stands for Strategic Analytics for Improvement and Learning. It was designed specifically by the VA to promote high quality, safety, and value-based healthcare within all of its medical centers. As of Q3, Central Texas remains a 3-star facility and is currently ranked 88 out of 130 acute care hospitals. There are, however, some areas where we need to concentrate on and improve in. Some of these areas include, on an inpatient side, our acute care mortality and our avoidable adverse events, which includes our in-hospital complications and our healthcare associated infections. Some of the outpatient things that we need to improve on include our primary care access, the rating of our primary care providers, and our mental health experience of care. We also need to work on some of our outpatient performance measures, such as behavioral health, tobacco, and prevention measures. However, I would like to include all the several things that our facility continues to do well in. These include our outpatient diabetic and ischemic heart disease measures, our physician capacity, our call responsiveness, our RN turnover, our adjusted length of stay, our ambulatory care sensitive condition hospitalizations, our mental health continuity of care and population coverage, and the rating of our hospital. We've also made significant improvement in our hospital-wide readmission rate and our specialty care survey access. We will continue to strive to improve in the quality of care that we provide our veteran satisfaction, and in our SAIL rating to ensure that we are with and supporting our VHA's mission and vision.
Hello, my name is Garrett Roof, Group Practice Manager at Central Texas Veterans Healthcare System. I'd like to take a moment to discuss with you updates for veterans' access to healthcare. One of the most important commitments to our veterans is to provide timely, quality healthcare. To that end, Central Texas and VHA share a mission to provide same-day services for both primary care and mental health services. Same-day services for primary care. If you need care right away during regular office hours, you are able to get services the same day, or if after hours, by the next day from a healthcare center. Options for how that care might be provided include in-person, via telephone, smartphone, through video care, secure message, and other options. If care is needed right away during regular business hours, patients are able to get services the same day, or if after hours, by the next day. Mental health. If the veteran is in crisis or has another need for care right away in mental health, they will receive immediate attention from a healthcare professional at a VA clinic. Any veteran new to mental health with a non-urgent need will receive an initial screening evaluation by the next calendar day. Another goal of VHA is to improve awareness of appointment wait times for many of our clinical services. This is accomplished through the Access to Care website. Veterans can easily see the existing wait times for primary care, mental health, cardiology, and other specialties at a facility near them. We must be vigilant in our efforts to improve access. As you can see in the SHEP survey to access, in which the number 1 represents the best and 5 the worst, we have done well in areas and not so well in others. In order for our veterans to choose VA, we must improve the trust of our veterans and at the same time improve access to timely care. So what have we done to improve access at Central Texas Veterans Healthcare System? We have launched several programs to improve access to our veterans. For example, through patient self-referral direct scheduling initiatives, our veterans are now able to request an appointment in podiatry, optometry, audiology, and most recently for mammography screening, and also our pharmacy clinics, all without the need to see a primary care provider for authorization. And there will be more specialties added in FY19. Another program which has improved veterans' access to care is online scheduling, formerly known as VAR, which allows veterans to request an appointment or directly schedule an appointment themselves through a software application. Currently, veterans are using this technology for primary care and mental health appointments. Soon, our veterans will be able to use this technology to directly request a clinical pharmacy appointment, and additional specialties are expected to launch in FY19 as well. Please be aware that veterans who wish to use online scheduling must have a MyHealthyVet Premium account or a DS Login Premium account. With that said, the online scheduling feature is far from the only benefit of upgrading to a premium MyHealthyVet account. With an upgraded MyHealthyVet account, our veterans can communicate with their healthcare teams by way of secure message communication, view their upcoming appointments, access lab results, VA notes, medical images, and much more. And finally, VA Video Connect has been launched. This technology is a new VA solution that enables veterans to virtually meet up with their VA healthcare providers in something called a virtual medical room, using encrypted video to ensure this session is secure and private. It allows veterans to see and talk to their healthcare team from anywhere, make VA healthcare more convenient, and reduce travel times for veterans, especially for those in rural areas with limited access to VA healthcare facilities. This healthcare platform is being deployed in mental health and primary care and will continue to expand to other specialty care areas soon. I would like to thank you for your time, attention, and commitment to expanding access to patient care for our veterans here at Central Texas Veterans Healthcare System.
Hello, my name is Lavita Springer, and I'm your Nursing Excellence Coordinator for the Central Texas Veterans Healthcare System. Today I'm excited to provide you with an overview about our Pathway to Excellence journey. Pathway to Excellence has Texas roots. The program evolved from the former Texas Nurses Association Texas Nurse Friendly Hospital Initiative, which launched in 2003. 51 hospitals earned that distinction, meeting 12 practice standards to improve the work environment for nurses, and as a result, retention of quality nurses increased. In 2007, American Nurses Credentialing Center, or ANCC, assumed ownership of the program, which is now an international designation awarded to the best healthcare organizations throughout the world. Currently, the ANCC has reduced the 12 practice standards to 6 practice standards. There are approximately 170 VA medical centers and 1,063 outpatient sites. Currently, 4 veterans healthcare facilities are designated as Magnet and 2 are designated as Pathway. More than 20 additional facilities are in some phase of formal application, and another 70 plus have adopted Magnet and/or Pathway to Excellence principles. Only 3.5% of veteran healthcare systems are Magnet or Pathway to Excellence designated. This journey will benefit nurses, the interdisciplinary team, and our veterans. Nurses will be empowered in having input into how nursing care is delivered. The interdisciplinary team will be strengthened through enhanced collaboration across services. And the veteran wins by having nurses who deliver safe and quality care that is current and evidence-based. There's a lot of work to do, and we need your help. Coming soon, I will be seeking volunteers who would like to represent their teams as an ambassador, and there will be a call for a team to lead the quarterly newsletter. The goal is the journey, not the designation. It will not be easy, but together with the staff at the front line serving as our compass, leading our pursuit of excellence, I am confident that we as a health system will be the example of true sustained excellence for all other systems to follow. Pathway to Excellence will cause a shift to our current culture. This journey will create opportunities for new knowledge development, identification of emerging servant leaders, improved communication and sharing across services, and enhanced collaboration with our interdisciplinary teams to meet the needs of our veterans. Always remember, the front line is the bottom line. If you would like more information about our journey, please contact me or visit the sites provided.